Starting back in 1983, I was actually in on the committee that brought liposuction from France and Italy to the United States. We had our first meeting at the Graduate Hospital of Philadelphia in 1983, inviting Dr. Pierre Fournier and Dr. Giorgio Fischer, who taught that course. I've been doing liposuction since 1983. There is no better technique out there for body sculpting than liposculpting. In our practice, we've advanced liposuction surgery in many different ways. We have promoted and teach other cosmetic surgeons to embrace the concept of smaller cannulas or smaller instrumentation, giving the patients a much more fine and smoother result with less trauma and less bruising. The second thing we've promoted is the adjunctive use of things like water injection to break up the fatty tissue, laser in some cases to break up the fatty tissue, and ultrasonic techniques to be able to break up the fatty tissue to assist in the molding of the tissue. The other thing that we have promoted over the years is this concept of liposhifting, which means you take fat from one area and you shift it to another area so that you can take down a little bit of a hill and fill perhaps a valley. You end up with a smoother result on the surface and a much more happy patient. So with the advent of liposuction, cosmetic surgery has really revolutionized. But with the advent of liposhifting and fat transplant, taking that fatty tissue and moving it into other areas, really body sculpting has advanced into the future.
One good thing that I observed, the doctor that I went to before said to me, liposuction he'd done on blacks in the past, he noticed that the bodies don't seem to want to give up their fat. That way he didn't feel like he could contour with the kind of effect he was going for. I didn't have that with Dr. Rubenstein. I got a better result, and I'll tell you why. He suggested in dermotherapy. I had it before the surgery. I had it after the surgery. I never got sick during or after any of these procedures. When I had the initial surgery by another doctor, who shall remain nameless, I had to take Compazine. I was always dizzy. I had lots of leakage from the incisions. It was just a very uncomfortable and unpleasant situation. My mother thought I was bleeding to death, and we had papers all around the house where all of this stuff was giving off or effusive, whatever it was, reddish liquid everywhere. And I had to change my clothes several times a day, change the bedding. I never had that. I don't know why whatever he did different, it didn't happen. I didn't have any of that. I had minimal swelling. I had no nausea. I mean, I felt fine. I went back to work in 3 days. I never did that with anybody else.